Hi, I'm Nancy O'Neill. What does aging gracefully mean to you? Well, it means something different to everyone. No matter what age you may be, Aging Gracefully on Suncoast FYI offers advice that could help you live a healthier life. Each week, we hear from a variety of specialists on a wide range of subjects. So please join us for Aging Gracefully on Suncoast FYI. This week, we continue our discussion of liposuction with Dr. Sessa, cutting deeper into the area of tummy tucks. Welcome back, Doctor. Nice
Thanks.
to see you.
Yeah.
Now, when somebody's considering this procedure of liposuction, when does it become something more than just that?
Yeah. So during my consultations, when somebody comes in for a liposuction consultation, the first thing I look at is I assess the quantity of fat and their skin elasticity. So as far as the quantity of fat goes, liposuction has its limits, and there's only so much we're allowed medically to take out safely, and also it has its limits in terms of the amount of contours. So so that's the first thing I assess. The second thing is the amount of skin, how the skin lies, and then I combine all of that with what the patient wishes and what they're looking for. So if they tell me, doctor, I don't care about the loose skin, I don't care if my skin looks crinkly, I'm 70 years old, I just want to fit in a dress, I just want to feel more comfortable, then it's liposuction.
Okay.
If they say, no, I wear my bathing suit a lot, I work out a lot, I'm tired of having this skin and fat down here, then it's something more involved.
Okay.
On the liposuction tummy tuck is great procedure for that, because once I do the liposuction and I'll flatten out the tummy, the hips, the flanks, really bring in your waist, there's going to be a lot of loose skin left over.
Sure.
It's just not going to contract properly. So it's much better if I could just remove that skin from your belly button down, and so it comes out in like an ellipse, like a big football, if you will.
Yeah.
So it comes across all the way down, so it's like a big diamond.
Yep.
And all that skin gets removed, as well as the fat, and then we pull the skin down. If the muscle needs to be tightened, because when you've had children, it's splayed your muscles apart, we could take care of that at the same time, and that has a flattening effect on your belly.
Okay.
And when I do that, the final result is transformative. Those are the types of procedures where you see big changes.
Instantly.
Yeah,
Really.
big changes. Instantly, of course, but then generally it takes about a month to 6 weeks before everything really contracts in. The fat that hasn't been sucked out gets dissolved, removed by your natural processes in your body. And that's where you really see the sort of, wow, what a transformation.
Okay. Now, a lot of people exercise and still have this problem.
Yeah.
So what are the benefits for them? Obviously, I mean, they're going to see these fabulous results, but they're still going to have great muscle tone. You're just going to give them more definition?
Yeah.
Or?
So really depends on the amount of loose skin that they have.
Okay.
So if I'm grabbing the skin and I'm pinching the skin, if you just have a little bit of loose skin above your belly button or a little bit below, tummy tuck's probably not going to do it for you. Although a mini tummy tuck with a much shorter scar and some liposuction might be the trick. Or you may settle for a non-surgical procedure, which I have a device called the Vanquish at my office, which FDA approved to melt fat on your stomach and your hips, as well as tighten skin, non-surgical, but not to the extent that you would see with surgical procedure. So it depends on what your goals are, what you're looking to do, how active you are, your body type, the condition of your skin. Has a lot to do with the treatment plan that I'm going to put forth.
Now, who is a possible candidate for the one that you just mentioned, the one that's non-invasive?
So if you have sort of pockets of fat or a little pooch or a little bit of loose skin associated with a little bit of fat, non-surgical is great. If you have kind of a big tummy and you could squeeze, if you could do that, non-surgical treatments are probably going to fall short unless you're looking for 15%, 20% improvement. 15 to 20% non-surgical, 85 to 90 to 100% is surgery.
Okay.
And
now,
it's all permanent.
sorry. Okay.
Yeah.
Now, when you remove the fat,
Yeah.
What kind of volume are we talking about? You said there was a certain amount that was prescribed.
So a couple of things about that. So the Board of Medicine sort of in Florida is very active. And they made sort of general regulations where you should not go over 4 liters of removal for a single liposuction procedure. Now that might change if you perform the surgery within a hospital. They have sort of a little bit less strict standards. But as far as safety goes, and as far as if you do a literature review, and 4 liters is a very safe amount that you could remove from someone and not run into potential issues medically. Because no one wants that.
No.
You know, this is elective cosmetic surgery.
Sure. Now, for those who aren't familiar with the metric system, what is a liter equivalent to?
So a liter,
quart, half gallon.
you got me on that one. You know, I know it in cc's. A liter is 1,000, is roughly 750 cc's, but I'm pretty sure that there in a gallon there's a little bit more than 4 liters.
Okay,
in a gallon.
so roughly that's about how much
it's a little bit less than a quart.
Okay. And pounds, do you lose weight as well when you have this removed?
So every 400 cc's is about a pound. So my average liposuction case is probably about 2,000 cc's, maybe 2,500. And if I'm doing a lipo tummy tuck, it's generally 4 liters.
Okay, so that's huge amount of fat to get rid of.
Big changes. Yeah.
Awesome. Well, thank you again,
Thank you.
We'll see you next week.
Thank you.
Thank you. Please stay tuned. Aging Gracefully on Suncoast FYI will return after a short break. Returning to the studio from Sarasota Vascular Specialists is Dr. Sampson to talk about aortic aneurysms. Hello, doctor.
Hi.
Feels like we're old
friends.
friends. Yes, I like that. I like that. Can you tell us what aneurysms are? Is there a number of different types of aneurysms?
There are a number, so I'm going to be talking about one specific type. But an aneurysm is any bulging of an artery. So we've spoken about arteries that take blood away from the heart. They're normally just narrow tubes. When they weaken, they blow out like a balloon. So an aneurysm is a ballooning of an artery. So there are arteries that can be an aneurysm in the brain. I don't talk about that because that's a completely different condition. Neurosurgeons deal with that. But there are certain sites of the body where these other aneurysms can happen, and the main area is in so-called the aorta. That's the main big artery that comes out of the heart, goes through the chest, down through the abdomen towards the legs. And the main area where people tend to get aneurysms is as that main artery goes into the abdominal region, it's an area where it starts to balloon out.
So is it harder to notice or feel? I mean, I would think if something was bulging out that you would see it, but in your abdominal cavity, you don't know whether
You're 100% right. People don't know they even have it because it's completely asymptomatic. In other words, it sits there and starts to balloon out and the patient doesn't feel a thing. And then all of a sudden it gets to a size where it's so big that it bursts. And then all the blood comes rushing out into the abdominal cavity, and that's usually fatal. So in other words, it happens so quickly that some patients don't even know they had it, and they may be diagnosed as having had a heart attack and just dying on the spot. But other people will have severe abdominal pain, really severe abdominal pain, back pain. They come rushing into the emergency room with low blood pressure. They're obviously terribly ill, and then we have to rush them to surgery. So what's important with an aneurysm is to find it before it ruptures, and that's the whole key here.
Okay. Well, and again, since you said they're so hard, symptoms, what are the symptoms?
None. No symptoms.
No symptoms?
No, none at all.
Oh my gosh.
So they're picked up in the abdominal cavity by a good doctor. When you go for your physical, we are talking about aging gracefully. This is really a condition of older people. So when you go for your physical, the doctor will put their hands on your tummy And if they feel this kind of this pulse
Right.
that's abnormal, they'll send the patient to a vascular surgeon for a checkup. Sometimes they're just found by chance. So the patient has some abdominal discomfort. For some other reason, they get an ultrasound or they get a CAT scan. Lo and behold, there's an aneurysm.
Okay.
So then they are referred to us.
Okay. And what types of treatments do you
So the
use for
important
these?
thing here, small aneurysms are very unlikely to rupture. So it's just like a balloon. When you blow up a balloon, you
Right.
don't expect it to just burst as you're blowing it up.
Right.
Of course it can.
Yep.
But as it gets bigger. So what we do is either on a CAT scan, which is really just a fancy X-ray, or an ultrasound, we measure the aneurysm, and if it's greater than 5.5 centimeters, which is a little bit about the same size as this artificial fruit,
Okay.
if it gets to that size, then we would do something to fix it.
Okay. And what types of treatments are there?
So in the old days, which is even now to tell you the truth, the main way of doing it was a big open operation. Go to sleep, cut the abdomen open, cut out the aneurysm and replace it. That's about 6 days in the hospital, recuperating at home, and about 2% of people actually die from the surgery. But fortunately, over the last 15 or so years, we've had a new way of doing it where we go in through the groin and we actually put an artificial artery inside the aneurysm, much like an inner tube in a tire. And we do that through a little puncture wound in the groin. And that's an overnight stay in the hospital and home the next day. It's been a major advance.
So what that does is, overrides the aneurysm, and what happens to all the blood that's been in that
You're
artery?
very good at your question. So what happens is you've got this inner tube, and so the blood's going in the inner tube, but there's this sac of normal blood vessel around it.
Right.
Well, that blood gets trapped and just forms a clot. And the clot just stays there, and slowly the body absorbs it, and the aneurysm goes away.
Okay, and it dries up,
And
basically.
it dries up basically and goes
Okay,
away.
all right.
So another place where you can get an aneurysm is in the chest, where the artery comes out. Now that's very hard to diagnose because nobody can feel through your rib cage and see you've got an aneurysm. So that is usually found by chance on a chest X-ray or in someone that may have had a history of aneurysms. Now there's one other aneurysm I'd like to speak about, and that's called a dissecting aneurysm. And that's a condition where people who have very, very high blood pressure, something maybe like 200 over 100, will suddenly get a tear in the main artery. And they get tremendous sudden chest pain in the chest. And the blood goes down the wall of the artery, and then it kind of blocks the artery off, and that can cause circulation trouble and also sudden death. So that happened to John Ritter, the famous actor from, TV actor.
Yes.
So again, if you get sudden severe chest pain, that's not necessarily a heart attack. But if
Okay.
you have it and you're in that situation, again, the emergency room is the safest place to be.
Okay. And again, go to a specialist because not all physicians,
Right, well,
surgeons
then-
are able to treat aneurysms.
Most aneurysms are treated by vascular surgeons. There are some other specialists that get involved with it, but usually the people that do the most of these are so-called vascular surgeons that are board certified by the American Board of Surgery with special qualifications in vascular surgery.
Okay. Well, again, always nice to see you, and
Thank you for the invite.
see you again.
Sure.
Thank you, Doctor. Thank you for tuning in to Aging Gracefully on Suncoast FYI. We'll return right after the break. Every time this year, Sarasota sees an influx of tourists taking in the abundance of our sunshine. Dr. Hornberger is here to talk about how this increase affects the accidents in our area. Hi, Doctor, and welcome back to the show.
Hi, how are you today?
Good.
Good.
Now, we do see an increase in traffic, so obviously there's going to be an increase in traffic accidents. And what does that mean this time of year to how many people you see?
Well, we see many more car accident victims this time of year, and I'm glad you asked this question because it has a lot to do with our health and longevity and how we age. Many people I see with chronic disability from a car accident either didn't seek care at all after the accident, or they went and seek the wrong kind of treatment. Okay, so it's very important to find the right doctor to go to after a car accident.
Okay. Now, there's obviously medical bills involved, and I think that might be something that deters people from coming to see you. So after a car accident, are they responsible for paying the bills out of their own pocket?
Also a great question, because many people think that their health insurance is going to cover it, or they're going to have to pay cash out of their pocket. And you know, with the rate of the deductibles these days are getting higher and higher, and
Right.
so they don't seek treatment at all. And the fact of the matter is your car insurance will actually pay for your medical bills, or most of them. Now it's important to note that you have to see a medical doctor, go to the emergency room, or see a chiropractor, one of the three and only the three, within 2 weeks after a car accident.
Okay.
Otherwise your benefits for your car insurance will not cover a thing. Another interesting point is that it's common not to have symptoms after a car accident days, even
Right.
weeks after the
Right.
accident. So even if you feel fine after the accident, it's very important to come in and get checked so we could detect problems early.
Right, and that's it. I mean, I've been in a couple car accidents, and you don't. I think whether you're in shock or whatever, but you know, you say, oh, I'm fine, but you really should go see a doctor.
Absolutely.
Right
yes,
away.
Right away.
So after you've seen a doctor, I mean, see a doctor, you get your assessment done. How can something like an accident lead to more serious complications if they're not treated, such as spinal issues or disabilities later in life that may be much more serious?
Yeah, absolutely. So through life, if you have an accident, you have injuries to the muscles and ligaments. And when you're in an accident, your spine acts like a spring, and it absorbs a lot of the force of the accident. So these muscles and ligaments that support the spine rip and they tear, and they allow vertebra to misalign. And if nothing is done after this, scar tissue begins to set in, and the scar tissue will actually hold the vertebra out of place, and the muscles will heal incorrectly, which leads to long-term stiffness, tightness, and then if you have misaligned vertebra, they'll actually pinch on nerves that go to all the organs, tissues, and cells of our body. So it can actually affect the way we function and the way our body is functioning through our lifetime, which can lead to long-term disability.
Right.
And second of all, if you end up with an arthritic condition from lack of motion in the vertebra, then it's going to be harder to move. You're going to get less exercise. If you get less exercise, then you're going to have more issues with your health.
Right, so one thing just basically leads to another. You really have to take care of yourself.
It's really a snowball effect, yes.
Yeah. So chiropractors, such as yourself in particular, folks would go to see you after a car accident, and you begin the assessment process. All right, they may come in and say, well, I had such and such an accident, but I don't feel any symptoms. How do you first start diagnosing, whether or not they have had any kind of injury?
Well, first we take a thorough history, and we discuss what happened in the car accident. Was their head turned to the side? So we try and focus in on the part of the body that would have been injured. After that, we do orthopedic, neurologic, and chiropractic examination, and these will provoke symptoms if there's something wrong. Even if they feel great, we're going to try and provoke symptoms in the spine, and that happens about 80–90% of the time. We'll find something going on, even if the person feels great. And 2 weeks later, the patient will tell us, oh yeah, I'm having symptoms now, or I'm glad we came in and got checked because we got to the bottom of this ahead of time.
Okay. One interesting thing that you said, because I've gone to chiropractors during the course of my life, people will come out and say, you know what, I felt worse after I went to see the doctor. Okay, and I think that just speaks to the fact that if your body's been out of alignment so long and your muscles have kind of molded incorrectly, is that true?
Well, yeah, if you have a chronic ongoing condition, your body will actually compensate to the misalignments in your spine. And like I said, the scar tissue holds the vertebra out of alignment, which can lead to health problems in the future. So after an adjustment, it's not uncommon to have a little bit of soreness, kind of like you went to the gym, because we're freeing up these vertebrae that have been locked into place. But you'll see after about a week or two, it's actually going to feel excellent to get an adjustment, and you'll
Yeah.
feel lighter and better. Your energy
Yeah.
comes back. People sleep better. It's really pretty rewarding as a chiropractor to see.
Okay, great. Well, thank you for clarifying that,
Yeah,
because I think
absolutely.
that's a misconception with a lot of folks.
It is. It is.
Nice to see you again,
Yeah,
and
absolutely.
thanks, and best of luck with your season this year.
Absolutely. And
Right.
I'd like to invite anybody that's been in a car accident to come in. I'd love to check them over and see what we could do for them.
All right,
Yeah.
great. Thanks, Doctor.
You're very welcome.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. To find previous episodes, go to snntv.com under programming. See you next Saturday and Sunday at noon.